let you know.
Sir.
Hey, good morning.
I'm like, before you say anything, you hot. Your mic is hot. Your mic is
Yeah.
hot. Good morning.
Good morning.
How you doing?
I'm great and yourself.
I'm good. I've been chuckling at you all week. I couldn't wait. I can't wait to the meeting after the meeting.
Yes.
I tried to put a preview out there as a teaser, like, y'all don't want to miss this one. Y'all don't want to miss this meeting after the meeting. That's all I got. Y'all don't want to miss it. All right, all right. So how's everything else? How was your week?
It was actually good.
Good,
How
good.
about yours?
Y'all didn't have any weather challenges, did you?
Not at all.
Good, good, good. We were well, I told I told you I had an impromptu visit to Macon, and couldn't leave. Was gonna leave on Friday. Like, okay, well, I'll go home Friday. Then because they didn't really get impacted too much by the storm. The power went out a little bit overnight, but that was it. And then learned that everything hit through Atlanta. I'm like, oh, and then found out like the highway was closed down for hours, and so I'm glad I did not leave because I would have been not a happy camper sitting on the expressway for 5 hours. Um, but so I was like, okay, I'll leave on Saturday. I'll come on home, whatever. And nobody told me about Tennessee. Ran smack into all of the weather, rain, storm, all of the things in Tennessee coming home. So I was like, well, we out here now, girl. Keep it moving, keep it moving. So we did that. And then get home, and my neighbor has a tree that overhangs in my driveway. Branches, large, huge branches fell off the tree and hit my daughter's car, my other daughter's car, and busted out her windows and damaged. And I was like, oh, good
Oh, wow.
Lord. So they had a lot of stuff going on here with wind, and it looked like a war zone out there. Trees down all over the place and branches and just stuff. So, but
Well,
it looks back to normal now. So, and I don't think anybody was hurt. Oh, and power was out. I had internet. You forget power. I need internet. But yeah, but I mean, I think everybody was okay. And if anybody had been impacted, um, by the storm or whatever, definitely prayers and thoughts are with you, especially those who
definitely.
lost their lives or whatever. And I was talking to somebody about this, and I was like, the first thing that you want to say is, well, they told you the storm was coming, just go. And I remember how I felt, with Katrina, like they told y'all, but then I feel like we come from a place of privilege where we can just pack up and go, or we have the resources to pack up. And you have to think a lot of people don't. They don't. And go where? If all of their family, if everybody they know and love and everything is right there, where are they going? There's no going to where. So, that a lot of that. And then, oh, I'll never forget how they talked about, um, and I don't know how other states operate and do, but not considering, because you have the some states, cities, whatever, have the sirens. Well, some people are deaf; they can't hear that siren. Making accommodations for those who have impairments that may not be able to know, well, what is happening, what's going on, and then being able to go somebody to get them. They can't just leave on their own. They have, caregivers and that kind of thing. So just, thinking through all of those things, it's just a lot, just a lot.
Well, you said a mouthful because I think that people I hear echo
Is it me? I don't know. Okay, let me see. Go ahead. Just keep talking.
because some people forget about privilege. And it doesn't necessarily, I mean, everybody, like you said, get up and go where. And
Hmm.
then even when it's all over, you still have to come back to access the resources. If you went to a relative's house out of state, you still have to come back to whatever county you're in to get whatever services you need, if you can even get back.
Yeah.
So it's there's a lot of moving pieces to that.
Okay, I'm laughing at my comments. We have Buenos Dias.
Oh, buenos dias.
We got good morning. Good
Yeah. All right.
morning.
We are becoming international.
And good morning to our on the street correspondent, the Crafty Coder. Good
Yes.
morning. Good morning. Grand Rising. Grand
All
Rising,
right.
Regina. But you're right, and I think folks don't think about that. And then, yeah, just a mess, and just being. I think there's a lot to being prepared, not just individuals, but your infrastructure, your government infrastructure, being prepared for what could happen. And oftentimes, I know people were talking about, I think Asheville, they weren't prepared for anything like that. Um, but you got to consider, we got climate change and weather is crazy. Everybody, you got to stay ready.
Hmm.
Stay ready at all times, because you never know what could happen. And you think, well, that would never happen here, or we don't even get that. Well, here we are. Here we are. So, okay. Enough about that. We need happy things. Happy things. Well, welcome everybody to our Saturday morning tea, where we brew up the hottest topics in healthcare. We discuss health information, news, education, certification tips, entrepreneurship, the weather, being
Yeah.
prepared, staying ready so you don't have to get ready. That actually applies to all kinds of things. Being international, Buenos Dias and Guten Morgen and all of the
Hmm.
things. Just all of the things. But basically, the revenue cycle at large. Um, don't forget, as you come in, to hit the thumbs up or like button. I'm Clarice Warner. I'm the girl with the pearls. I am the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle, um, regulatory compliance, and education. And let me ask you, do you know what it takes to be a certified marketable medical coder? Well, before I introduce my co host, even though we've been talking for a minute, let me share with you information on a free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start, and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. See, I'm gonna have to every time I see my little hats, I'm gonna have to talk to my hairdresser like, ma'am, I need to put my hats on. We can't do this. I can't wear a hat with this. Or I'm gonna have to go find some bigger rims. Oh, I
Yep.
went to we had a art exhibit on hip hop, the culture, 21st century, something, da da da. I don't remember all the title. And oh, who is his name? See, I'm drawing a blank. Um, I don't know, but his mom used to wear, it's called a buffalo hat. And so it had that bigger brim thing. And so he started wearing it as part of, his hip hop persona, trend, or whatever. And it was like, yeah, it was making a comeback. I was like, I need to find him. I never heard of a buffalo hat before. That'll cover all of this. I could use that. And I love a brim, because through osmosis, because I never met my grandfather. My grandfather was gone, but I've seen massive pictures, and somehow or another, I have inherited his keen sense of dipping that brim to the side. And so that's what I do when I wear my hat. It was like, where you get that from? I was like, I see my granddaddy did it. I must have got it from my granddaddy.
Mhm.
Because he was mean with the hats. And I love my hats dipped to the side. Okay. Anyway, If you are interested in getting more information about the 5 steps to become a certified marketable medical coder, check the video description for the link. Now, joining me today is my partner in success, my co-host, Mr. Jesse, the registered trademark. Put some respect on his name. The coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for a very long time. I left the bedside in 2014 and transitioned into medical coding during the pandemic. In 2020, I created a company, the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
And how is that going?
It's coming along.
Coming
It just,
along.
honestly, it just feels like I have the same conversation all the time. Everybody has the same questions. It's just like I'm like, I guess I answer my own question and I always say, well, when are people going to realize? And it's never. I just have to accept it and just go along with it.
Which makes us valuable and employable and will always have and allows for the entrepreneurial endeavors that we encounter and all of the things because as you said, it's the same questions all the time, over and over again.
Over
And
and over.
you accept, at least for me, I accept it easier. It's more palatable to get it from a new provider or a new person. But somebody been in the game for 30 years, really? where where you been, sweetie? What's happening? What's going on? Ain't nobody told you nothing? I don't know. Well, before we jump in, let me remind you that you can join in and add to the conversation. Like we bring the topics, we talk about the things, we add our spin in it, and we want you to add yours as well. So don't be shy. Your opinion matters and more importantly is welcomed here. So friends, use the chat. That's where we can have our robust conversation. And if you have a question, just please type Q first so that we know it is a question for us and we don't miss it. And it's not something that, y'all having your own conversation in the chat about because we like to have conversation, right?
Definitely.
So, um, for those who are joining us or watching the replay, today we're talking about the 2025 ICD-10-CM code changes and what you need to know. It was a lot going on. I said, well, wait a minute. Had I heard, have we mentioned, have we talked? Now we already 5 days in. Y'all know our HIM medical coding New Year is October 1st. So happy New Year to all. It's like Christmas. Everything is new and bright and shiny and all kinds of stuff. Even though for the past several months, folks have been trickling information and all of the things. And I thought, well, let's take a moment to dig a little deeper into what we can experience as hopefully we've already cracked open those books or checked out whatever is in our encoders and all of the things. And hopefully all of those have been updated and have all of the wonderful things that, that you need to make sure that you are capturing all of the services accurately. So, but before we get into all of that, let's have our church announcement, shall we? Shall we? Shall we? Hey, 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 hey. Hey. I can just do the double clap. Yay. Yay. Hey. Okay. I love it. I love it. All right. Did you flip my side? Did I see Martin Luther?
Oh, yeah.
There we go. All right. I was like, where was the flipping of the side? All right. Okay. So one thing, kind of in conjunction with what we're going to talk about today, is that CMS has updated their website a little bit, and so they've moved where they keep the ICD-10 code sets on their website. So if you go out to www.cms.gov, there's a new tab called coding and billing. Just plain coding and billing. Trying to make things a little easier for you, and you can go there and you will have access to the files to download to see all of the different changes. One thing is, if you go to those files and go to the tables, let me see, maybe I can show you. How about we just do that? Sharing is caring. Okay. Okay, so if you go to the area, this is the Medicare, starts the Medicare website. You click into the coding and billing area and you can see the ICD-10 codes. If you go down to the files, and I believe it's here, and you want to go to the code tables, it's a zip file. I don't know if I'll be able to open up all of that. You can't see. Look, y'all can see it all, can't y'all? Okay. Mm-hmm. Index neoplasm tabular. I want tables. Oh, I hit tabular. I want tables. I thought I hit the right thing. Where is the tables? Well, there are tables. It's table 6A. Gives you a full list of all of the new codes. So it gives you the code, the actual code, and then the code description. And then 6, I think it's 6E. Is it either 6D or 6E? Gives you all of the deleted codes. So it gives you the code and the code description. And then there's another table that gives you revisions. And so easily, if you ever want to just easily pop in to see, okay, well, what are the codes and what are all of the things, that's where you can find them. I don't know why it's not opening up the actual codes itself, though. And it's giving me tabular. So, go ahead.
But you think it's, once you open up that folder, that the table will be inside there, inside there?
No, because it didn't look like this yesterday.
Oh, okay.
So I don't know what I opened up yesterday. I should have had a walkthrough. I can look, but no, it was actually like, wait. Maybe it's here. Code tables.
No, that's PCS.
Oh, that's PCS. No, where is it? It was so nice and easily accessible. And I don't think I went here. Boom. Nope, that's the same thing. Well, let's look. Those are indexes. That's a neoplasm. That's the tabular. This There's a whole tabular section. No. It's drugs and chemicals. No. It was a whole. Is it an appendices? Addendum? I don't know. Let's look. Taking up all of my time over here in No, I have to find it, but I had it because I pulled them off because I was gonna go through step by step and read them, the descriptions for some of the stuff, but I said no, we won't do that. Well, never mind. And it's on my other computer, not on this one. But anyway, if you, I know
can't
if
come
you
to an
go
agreement
to,
behind these closed doors, the next thing that's about to happen is
if you go to the Federal Register where, or go to the inpatient. That's where I went. That's where I found it too. It should have been on here though. If you go to the IPPS final rule for 2025 and scroll down, and they actually have tables, and you can click on that button, and it's actually a zip file, and you can do it via a text file or an Excel file, and it'll show you the tables as well. So yeah, all of the things. Okay. So that was one announcement. All of that just for that announcement that the CMS has a new table. The other announcement is from AHIMA, and if you follow me on LinkedIn, I posted this on a link on LinkedIn. AHIMA is looking for folks to health information experts, and so they're looking for folks who's interested in serving as an AHIMA health information subject matter expert. Their subject matter experts can help with developing and reviewing content for
I'm
books,
expose you to the world.
online courses, webinar articles, and policy statements. Developing and presenting content for international engagement. That sounds like you. Working with the AHIMA certification team on reviewing and developing exam preparation materials, content, and exam content, and much more. And if you're interested, you can click a subject matter expert interest form and let them know that you're interested. Yeah, so there's an opportunity out there. Reach out and pull up. What I said was, here's an invitation to a seat at the table. Down, yes, sir.
and you get CEUs for them when you do.
Yes, you do. Yes,
because
and that's important.
Because I participated. What was it in last year? Was it? Yeah, it was last year for the CDI exam that they revamped. And then I got invited this year to because they revamped the CCS. So I got invited to do the same thing for the CCS exam, but I declined because the thing is, when you participate in that process, for a year.
They try
I'm
like, like you can't mess up with the money.
Exactly.
This is my livelihood. This is how we get down. All right,
I didn't. I mean, me personally, like I never tell anybody to go directly to their CCS. I mean, if you don't know what you're doing, it's a really hard exam because it covers 3 major code sets. So I tell people either do the inpatient and then learn CPT, or either do CCSP and then learn PCS, then take it. Because otherwise, I don't know anybody who has successfully done it fresh out the box.
Okay. Well, Mr. Jesse, did you have any announcement?
No, mine is. It's going to be too long, and it's for the meeting after the meeting.
I told y'all, hold your horses. Oh, and so we talked I think it was last week, or no, it wasn't last week because we didn't talk last week. The week before, or a couple weeks before, remember the House of Delegates meeting that is coming up, and we did do a whole program around the governance structure and all of the things, the different bylaw amendments. When I tell you we had a meeting this week and another amendment has reared its head, we usually have like breakout sessions. Like, so our House of Delegates is an all day event. They pulling out the breakout sessions because they know we gonna need every 8 hours to every hour of those 8 hours to go through and back and forth. They were back and forth on the town hall meeting. So when I tell you it's going down, everybody send a prayer out to Salt Lake City when we get out there. It's going down. down.
Look, are we going to need FEMA to come to Salt Lake City for disaster relief?
You might, because it's going down. And you had and at this last town hall meeting was even more interesting because you had the author of some of these bylaw amendment proposals on the call. And so she was like, wait a minute, da 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 da. And yeah, so we'll talk more about all of those things in the meeting after the meeting. So we got a lot to our hour or so is going to be jam-packed with information.
Well, it's going to be torn code books and lanyards all over Salt Lake City.
You're like, what's this stuff everywhere? This HEMA, what? Just stuff just floating in there.
Yes.
Oh, all right. So, well, let's let the tea spilling begin. So let's talk a little bit about the 2025 ICD-10-CM code changes. So let's talk about the numbers first. So we're looking at 200. I meant one of your. All right. Okay. Yay! Congratulations. I want to say that probably said Matt. One of your peoples at the Tri-State AHEMA conference. Her name is Tanya. I'm getting closer to meeting face to face. All right. Love it. Yeah, okay. I see you said Matt. Good. See how the community just bring the folks together.
Yep.
You never know who you know, what you know, and nothing's wrong with having a powerful community of like-minded professionals. Nothing in the world like it. So the numbers for what's happened with us this year, we're looking at 252 new codes. There were 36 codes that were deleted and 13 had revisions. There are also some, not a whole lot of big changes. I went through the ICD-10-CM guidelines, and I'll be putting together a video on that just to walk through what the new changes were. There are not a whole lot of changes, but most of the changes that were made are as a result of the code changes here. So be on the lookout for that. Anyway, we all know these changes went into effect on October 1st. So yeah, if you haven't done your preparation, you probably scrambling right now trying to make sure all of the things are all of the things. Well, you may want to know, or folks who are out there and are new to the field, well, why should we care? Well, we have to stay up to date. We have to stay up to date on the new codes and on the changes. And all of this is critical for not only coding accuracy, but also coding compliance and also making sure you get paid accurately. Yeah. You sending somebody a claim with an old code, they're like, we can't do nothing with this. Reject, denied. No. So you have to make sure that you are submitting things appropriately. And yes, sir.
Can I jump in real quickly?
Jump on in.
I'm in this medical billing and coding forum on Facebook, and I'm really not a Facebook person, but it just popped up. So, I'll click on it when I get that notification. I have like 99 notifications because I never look. So I saw one of this was last night. This woman had posted a screenshot of a denied claim. And the claim said that um, the coding was invalid. So what it was an outpatient encounter.
Mm-hmm.
The the first listed code was abdominal pain R10.9, but the person was then the code under it was a gallstone. So she was asking what does she need to do? And I'm like, everybody was like, well, the first thing is gallstone should be the first listed um, code, not the abdominal pain, because abdominal pain would be inherent if you had a gallstone.
Mm-hmm.
And it's just like those are little simple things that really
Mm-hmm.
can tie up your revenue, and people don't know. I don't know why,
But
but
should know. You knew where I was going. You knew where I was going. And they tell you all the time, if there is a definitive diagnosis, what are you doing? What are you doing? Okay. I don't understand. And well, that's a whole I thought about, and I may still do that too. Let me do a whole series on, let's just understand what our book is. What the conventions of the book. Like, can we get back to the basics? Like, if you understand what this means, then maybe it would trick. Well, I say that, but then I'm probably talking myself out of it because nobody wants to use a book. Everybody wants to use encoder. Well, somewhere in your encoder there should be some sort of you would notation, something. So even the app that I use an app. If I'm on the run, I use where's my app? It's an ICD-10 consult app. And so if I'm looking for, and they update it every year so the new codes are in here, they update it. And so I can search by, category. If I know the category and I know what I'm looking for, specifically a specific code, and I just want to know like the code description, or if I'm looking for a code and I can go in and put in the information, but it gives the notation. So it'll tell me, oh, you needed additional digit. This is, or all of those things that you see in your book. There should be some notation to make sure that you're getting your code, the most accurate code possible. I don't understand. Help me. Let's see. What you say? You want to care?
oh, Facebook medical billing and coding. That's my side of town. Oh, because those questions are
Lord, what is the difference between the AMA ICD-10 code book and the AAPC code book? Nothing. Oh, whoever published it. So the thing is, I'm about to say, and I don't like either one of them. But anyway, the thing is, because ICD-10 is developed by the cooperating parties, it's kind of open source, if you will. So as you saw in our church announcements, they give you all of the codes, they give you the tables, they give you all of the information. So people take that and then they go out and publish their own ICD-10 books. So that's why you have so many different publishers. Most of the differences are how they arrange things. So some of them have better diagrams and have added pictures and charts and tables and better, color coding and tabs and all of the things. But the core basics of what that book should be, everybody has. Unfortunately, at least I have run into some folks that be having typos. I don't know who's editing these things, and it's a whole hot mess. I think, and nobody is paying us for this podcast. Let me just say this. But Optum is my jam. I stick tried and true. You can't go wrong with an Optum code book. Now, CPT, on the other hand, the AMA got all of that on lock. There's only AMA CPT. If somebody trying to slide you, they brought man from the fifth floor trying to slide you something that ain't even real and don't exist. Only CPT comes from the AMA. But that's why you have so many different publishers of ICD-10 book. I think AHEMA actually has an ICD-10 book too. Everybody got them. You can get them. You can get them. You can make one. Everybody got them. So that's primarily the differences in them. He's like, I love them. I love them. You're welcome. You're welcome. And yeah, the layout. And so like, I know when I'm teaching in my courses, I give a recommended list of where you go, because then those are the books that I know. But every now and again, somebody comes with some other kind of book, and I'm like, well, I don't know your book. So it's your responsibility to make sure you know your book and know where things are in your book, because especially if you're preparing for examination, you have to be able to navigate your book, that book that you're bringing into your test. So make sure you know it. And then, we would get through different sections and talk about stuff. And I'll be like, well, you can reference this chart here, and they don't have that chart. Or you can reference this picture here, and they don't have that picture. And it's like, dang. And I'm like, I sent the list when up front, I sent the list. These are the recommended things that you should have to be successful.
I used when I first started, I used to do that, but I stopped that. I think like the first year. Now everybody has to use the same book, because when you start going through, oh, I can't find it, and an Optum page 20 is not an AAPC page 20, so you can't say turn to page 20. It just got to be too much.
Yeah.
And it's for me, because it's just no. So this way everybody's on the same page. Look, second column, come down to the middle. Look, you see this main term. Oh, okay. Because you have to learn. You have to be taught how to use the book properly,
Exactly.
and that's a lot of people's frustration with these coding books. They were never taught properly how to use them.
Correct.
Because they are amazing resources.
Amazing. Everything you need to know is right there in that book. And you follow up with the additional guidance. So you follow up with your coding clinic, or you follow up with the guidelines. But even the guidelines are in the book. So everything you need to know is right there in your fingertips. Especially when you're out in practice. But even if you're sitting for the exam, but you just need to know how to, for the exam purposes, you just need to know how to reference it quickly.
Right.
But yeah.
Tanika's the optimist and Maybach of books for me. I agree.
Amen. Amen. I sure enough agree.
And if you really time it right, you can they always discount their books. You don't have to pay full price.
You don't. And then if you have multiple people that are ordering together, you get discounts that way as well.
Yeah, because when I did my course earlier this year, I got like, I think it was like 20% off my bulk order.
Yep. Great question.
Yep.
Okay, so let's see. Okay, so here are some of the key changes. Oh, we're gonna run out of time. I gotta talk fast. Look, see, this is what happened when we ain't seen each other in a week. So in chapter 2, and I guess I should have been better and put what my chapter 2s are. Hold on.
Chapter 2 is neoplasms.
Thank you. Okay, so in your neoplasm chapter 2, there are a lot of codes that are around lymphoma. And most of this identifies the in remission status. And so for your oncology practices, make sure that you are dipping in and understanding what those new codes are so that you can identify them. We all know that, especially with HCC coding, cancer codes are a big thing, and folks are getting in trouble for not applying the appropriate codes. So make sure you check that out. Let's see, chapter 4 And I'm just skipping around. There are several, like I think all chapters 2, 3, 4, 5, 6, 7. No chapter 7. No chapter 8. Most of the chapters have some sort of new codes, but I'm just skipping around here. Chapter 4, which is your endocrine, nutritional, and metabolic diseases. Y'all know what lives there. Diabetes lives there. There are new codes for pre-symptomatic type 1 diabetes and obesity classifications. So your endocrinologists and primary care providers, they need to be all over that chapter, making sure they understand those new codes. Or if you're coding in those specialties, make sure you understand what those new codes are about and how they relate to the patients that you're seeing. Chapter 5 is for where I live, mental, behavior, and neurodevelopmental disorders. And they're providing more specificity for conditions like anorexia and bulimia, and also binge eating disorders. So check those out. For our neurology friends, in chapter 6, it introduces new codes related to KCNQ2, serotonin syndrome, and other disorders of the autonomic nervous system, and developmental and epileptic encephalopathies. So make sure you check those out. In chapter 9, which is diseases of the circulatory system, there are new codes for cement and fat pulmonary embolism. You know what? I'm gonna come right back to that. And this is particularly important for orthopedic and interventional radiology practices. When I saw that, the first thing I thought about were these BBLs and the stuff that people are injecting in their bodies that could potentially break off and go throughout the body. And I think we talked about all these embolisms that people are getting, and that hit me like wait a minute. So we getting stuff transferred here, transferred there. That was the first thing that I thought about, for real. Like people putting stuff here, putting stuff there. Hopefully going to a qualified, board certified, whomever practitioner to do all of this. But if not, you just going out to the people, and it's a lot of folks going out to the people because we like stuff on sale, and they putting all kinds of stuff in folks' bodies. Like, oh my God, this could be where some of this stuff is coming from.
Absolutely.
That was the first thing I thought about. Okay, chapter 10. Chapter 10. Wait a minute, she said not the smelly BBL. Ma'am.
And then
go ahead.
Did anybody hear about the man that just got arrested in Atlanta for pretending to be a dentist and was doing veneers? It was this week he got arrested, earlier this week. I want to say Thursday.
All I can think about, who showed my youngest child. Now, first of all, let me just tell y'all, I love T.I. T.I. is one of my favorites. Everything about him. I love me. Now, I love me some T.I. But anyway, y'all know his son got these veneers that are huge. Like, they take over his whole mouth. And he looks like the WB little frog thing with them veneers. And so people are allowing people to shave their teeth down to little bitty nubs to put these huge teeth on. Right. He probably did T.I.'s son, because he was doing celebrity veneers too. He probably did T.I.'s son because they were horrible. Horrible. Yes. They said it was on Instagram post. Wait a minute, let me go. It was an Instagram post where they were talking. Oh, this was something else. Sorry. Now back to your person. and taught a team of people who also did them too. So he teaching folks. He's becoming an educator. Oh goodness, he was giving classes.
Didn't have license to first.
Oh my God. Yes, that's what they was getting their little teeth down to. Yes, T.I. son teeth is ridiculous. It is. And he was even capping on his son. That's where I saw it, because T.I. was just going in on his son on the fly. Like they were doing a talk show, and I don't know who they were talking to, and they was just getting him, and I was in tears, like, woo, child.
But why didn't he just go where his father got his? Because T.I.'s veneers look very good.
Very good. I don't know, but how kids try to do whatever. And again, they trying to do something on sale. They think it's cheaper, and it was it.
That's not
Was
that
it?
you
Is it
can't
cheaper if you can't close your mouth? If your stuff is all, I don't
you,
understand.
you can't skim. I don't want to look like Mr. Ed about the mouth.
Oh, he said he never. Wait a minute. But he never said he was a dentist. He marketed himself as a veneer specialist.
But you still have to be a dentist to do that.
Wait a minute. Did y'all watch the movie ATL? See, this is why y'all, all of my hoodness is coming out. So, dude, his friend, he was a specialist. He was over there, but he was doing the gold veneers. But he was over there mixing up the stuff in the barbershop and doing. Yeah, Tanika, all of my stuff coming out. He was over there mixing the stuff up and putting it on people's teeth, and they was coming out like, yeah, he didn't even have a high school diploma. Oh my God. Oh my God. Mm-mm-mm. Okay. I'm sorry. We done got all off. All right. So real quick. Chapter 10. Did I skip? Yeah. Chapter 10 is for respiratory system. And there is a new code for nasal valve collapse. And so our ENT folks will appreciate this information and go out there. She said, oh
And
yeah, I know you have to be a dentist, but people don't read and comprehend. And again, they looking for a bargain. They think it's, yeah, okay. I always say you get what you pay for. How about that? Chapter 17 is congenital malformations, deformations, and chromosomal abnormalities. There are a lot of new codes that are around congenital heart conditions. So your pediatric cardiologist, or if you're coding for a pediatric cardiologist or coding for cardiology in general, there are some new codes there. So pay attention to that. And then our probably most updated every single year, Chapter 21, Factors Influencing Health Status and Contact with Health Services. There are new codes for social determinants of health, pediatric obesity, body mass index, personal history of colon polyps, and more. And all of these, of course, span multiple specialties. So make sure, even if you are coding in a particular specialty, that you also check out Chapter 21. There may be something that is of interest and beneficial to you as well. So some strategies on implementing these. Make sure that everybody on your team understands the changes that are relevant to their role in the revenue cycle, and can follow suit. And so if y'all have to kind of role-based training, what does that look like from the beginning through the end, as it relates to any codes that are new for your practices. Make sure that you all take a look at that. Make sure you coordinate with your EHR vendor, ensuring that the software is updated to reflect these changes. Also, communicate with your payers, check for any new documentation requirements or coverage changes. Medicare will put their information out on coverage changes as it relates to, or CMS in general, as it relates to these things. But then, the other payers, third-party payers, may have additional coverage guidance. And so peep those, make sure somebody is out there looking at their websites to determine or to see if there's anything that may change as it relates to these new codes. And then monitor claim denials. Make sure you keep a close eye on your denials, especially in the fourth quarter 2024, and address any of these issues promptly, because now it's kind of the training, the honeymoon cycle, if you will, where, you know, you're getting these new things and they're seeing things and then they're changing things. And then, you know, well, wait a minute, this is what it said it's for. And then it's like, oh no, this is not what we meant it was for. And then you'll get some additional guidance. So now is the crucial time to be monitoring those things as well. And again, remember, these changes aren't just about compliance, but they are about improving the specificity and accuracy of medical coding. And of course, this leads to better data, because remember, coding is, while all we normally focus on is the reimbursement, but it's also, you know, the statistical piece related to medical coding as well. So better data, which again how contributes to improved patient care. All right. So love to hear from you guys. What are your thoughts? How are these changes, or will these changes affect your specific medical specialty? And then what strategies are you implementing, or did you implement, to prepare for the October 1st deadline? And for those who've been through ICD-10 updates before, have you experienced any challenges? Do you have any tried and true strategies or techniques that you all use in your offices or practices that may help someone else? And then if you did experience some challenges, especially on the denials, and how did you overcome them? So as you think about those or think through those, feel free to have those conversations in the chat.
Now, my only question is, let's just say next year, because I've always used a book. So when you go, let's just say you're auditing and you have to audit a claim from this past June. Now, from the last I heard, these, when you use encoders, like once they update, they're updated. Like you can't go back. So you have to have a book to audit. Is that still true?
You should always have that book. You should always have, and you should have, where my books go back, you should have at least 5 years of books. As far as they can go back, I think 5 to 6 years was the sweet spot. You should have at least that many sets of books, because you coded that based on the guidance in that particular year. And so you should have that. You can't be like, oh, well, today it said da 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 da. Well, no, that wasn't even the rule today. This happened 3 years ago. So what was the rule then? And why wouldn't they keep like a backup of each year? But maybe they do, but they don't keep it. They don't give it to the customer.
But no, because there are places now that don't even teach from the book. They start with the encoder, and I'm like, so if you ever decide to go into auditing, you have to learn how to use the book, because they've never done it. I don't know how they do it. I mean, and then you need a book for the exam. So I just don't know. I don't know. Like there's always been too much of a reliance on. I've never liked encoders, because if you don't go down the right path, you're just all screwed up. You might as well just look it up in a book.
I don't either. And you know, some of those suggested codes don't fit the bill, and folks are trying to, oh, well, it said to go, but what did your documentation say? There's nothing to support you following this path. So stop. Stop. Yeah. So I don't know. Correct. Yeah. Well, you know that, I mean, I'm going back. What did she say? Denials and rejections. I sent an email to my provider this morning with a list of updated eating disorder, updated codes. she sees a lot of those patients, and so that makes you a reference and a resource for them. No, if the code is deleted, it will tell you it's deleted. Correct, but you got to go find out what that code was if it's something from before that they're, to Mr. Jesse's point, auditing you on, because it won't be in your current book or current information. And at some point, they stop telling you this stuff is deleted. And ICD-10 anyway. CPT will always have it's deleted, usually. In the same place at KC. First year with updates. Okay. But yeah, I always keep the books. I be holding on like, you can't have them. You can't have them. But
I would be lost without a book.
I need to see. Show me where it said so and so and so, and y'all sitting here relying on AI to help you solve this case without AI. AI ain't seen this case. They don't know nothing about this.
I cannot tell you how many times when I was doing inpatient CDI, even when I had coders who called themselves trying to give me the guideline to support what they were saying, like, I'm like, that's wrong. No. That's not even what it says. Just no. Just do better. That's all.
Do better. And they give you the information. It's not like you going in blind. They give it to you. Do better.
Exactly.
And there's no need to, what we say, it can all be so simple. There's no need to reinvent the wheel. Everything is right there for you. Just use it. All right.
And Renita has a question.
Oh, I'm sorry.
How long do you recommend holding books?
I hold them for 5 years.
I
hold them for 5 years.
And the furthest I've had to go back doing an audit was 3 years. But I've always heard that the sweet spot is 5 years. Keep your books for 5 years.
Well, because even with my clients, I've used them, or we've been in business, and so if I touched and was responsible, I make sure I hold on to those books for those purposes. If they get audited, because of course they gonna come to me and say, well, wait a minute, ma'am, you reviewed and you said, and I said, exactly, and I'll stand 10 toes down on what I said. However, let me show them the guidance that was based on what I had available to me at that time.
Now, Crafty Coder, I see what you're saying, but that's a business expense. You should be writing that off anyway.
Amen. And you can't keep them forever. I ain't got that kind of space. You know how big these books are?
Now, what I do like is, because what I do now from Optum is like every year I'll buy the physical and the digital.
So maybe that's what they have. You have the digital piece that is not necessarily tied to, because that's not tied to an encoder that you can go back and reference. And maybe they give them something like that. But again, who was it you say you got it from? Who did you say?
Optum.
Okay. Maybach, baby. Maybach.
Yes. They're going to get you right.
They're going to get you right. Girl, do you have stock in these people? Because you're always talking about them. I use both Codify and books. Codify has a tab that you can pick this year. Right now, it goes back to 2018.
Okay, well, that's good.
The digital is nice. Oh, I do write it off. Okay. All right. Well, we are close to the top of the hour. And as we wrap up, I want to remind everyone that staying informed is key. It is key. The CMS website is a great resource for the full list of changes. Even though I couldn't find the table, I'll put it. I'll look for it when we in the meeting, after the meeting, and put it out there. because I literally, because I was going to print it off. I was using it for another project, and I was going to print it off, but it would only let me print one page. And I was like, no, 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 no. So I needed to go in and make it a PDF, da, 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 da. And I jumped on something else and didn't go back. So I did have it, but I'll go back and find it and put it out there. Also don't forget to check out the updated ICD-10-CM official guidelines for coding and reporting. And again, I said I was going to put a video out there. I'm going to work on that this weekend. That is on my to-do list, just to let you know what the changes are for that. Well. This has been good. This has been good.
Absolutely.
This has been good. Where's my... Got too much stuff going on here. I'm getting squirrelish.
Uh-oh.
I love it. Is this the right one? Yeah, this is the right one. Okay. Well, before we go, did I put this out here? Yes. All right. So are you thirsty for fresh perspectives on the healthcare revenue cycle? By becoming one of the tea sippers, you'll join a community of sharp minds who savor the complexities of the healthcare revenue cycle. Why sip alone when you can steep in knowledge together? Come, let's spill the tea on industry insights. Here's what you can expect as a valued member of the Tea Sippers. Exclusive healthcare insights, gain access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices, as well as entrepreneurial information. Early access. Be the first to receive expert insights and guides, ensuring you stay ahead in the ever-evolving healthcare industry. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. And then my favorite, community connections. Join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. Oh, I'm reading this, crafty coder. So by supporting us, you're not only advancing your healthcare knowledge and career, but also contributing to the success of the Professional Reimbursement Network, LLC, a resource that empowers healthcare professionals like you to thrive in their roles, goals, and dreams. So thank you for considering becoming a member of the Tea Sippers. Check out the link in the description of the video. Your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. All right. Well, was the tea spilled today?
Absolutely.
All kinds of tea. Tea on people trying to be dentists and not, and just all kinds of stuff.
Yep.
Now, make sure you put your teacups in the chat. If the tea was spilled, put your teacups in the chat. Before we sign off, I've got a special request for all you amazing viewers out there. If you found this episode helpful, then don't keep it to yourself. Share the knowledge with your colleagues by hitting that share button. And why not subscribe to our channel while you're at it, if you're not already a subscriber? That way, you'll never miss a drop of our health information, compliance, revenue cycle, entrepreneurship, and medical coding tea. So you got thoughts or questions or experiences you want to share about these ICD-10 changes? Well, we'll love to hear from you. So drop a comment below and let's keep this conversation brewing, shall we? And if you enjoyed this episode, again, please give us a thumbs up. It helps more healthcare professionals find our content. And also, as always, check out the Coding Nurse channel on YouTube. Remember, at the Saturday Morning Tea, we're all about building a community of savvy, informed healthcare professionals. So again, like, share, subscribe, and comment. Let's grow this community together. Mr. Jesse, did you have any final comments?
No.
I see the tea. ICD. Okay. Well, this has been a great session today. See you tea sippers over in the next room at 10:15 a.m. Eastern Standard Time. I promise y'all, you won't be disappointed. I feel it in my spirit. You will not. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care. See you all later.